Hey everyone, so this will be my 1 month update. It's a few days past the 1 month mark. On Monday I had my third shot and I actually did the injection myself for the first time. So from now on I'm not going to be going to the local health center anymore. I'm just going to be doing it on my own, barring any sort of complications or anything like that, but I think it'll be fine because it didn't hurt at all and actually felt better for me to do the shot on my own than to have the nurse do it. Yeah, it just kind of went in really easy. Those needles are just so sharp. And I wanted to talk about a few changes. There's really, things have been very negligible almost, but I want to try to document stuff, meticulously, kind of for research purposes for other people who are thinking about similar options for low-dose testosterone. So, let's see. One thing, I don't really think my voice has changed. I don't know. We'll see. I feel like it'll be more noticeable in like 1 or 2 months. But my voice box does feel slightly tight after each injection and kind of scratchy, but it's really barely noticeable. I'm having definitely a few more pimples, especially right here, and it's also kind of itchy right here, and also my eyebrows have been itching a little, but definitely not as much acne as I was fearing. When I was a teenager, I definitely had not severe acne, but I wasn't like on Accutane or anything, but it was, borderline to that point, and so I'm grateful that it's not that bad right now. And connected to that is my skin has definitely changed a little bit. It's only noticeable on my facial skin, though. That's face and scalp skin is really where there's more DHT action from just androgenic stuff. My girlfriend says that my pores seem bigger, and I don't really. Our mirror in the bathroom is kind of far away from where, like, the edge of the counter is, so I never am in a situation where I'm looking at my face really close up. But yeah, she says my pores seem bigger. And she also says my hips look slightly narrower. That could just be from kind of working it at the gym. And I've been doing some more kind of leg exercises lately with our kung fu class and stuff. But, really small changes in that area of the body, small ratio changes are very perceivable, at kind of a subconscious level. So I feel like something probably has changed. As for downstairs growth, I wrote about it on my Tumblr a little bit, actually, kind of a lot, actually, because it's kind of, the most exciting effect for me. It's definitely there, but it's not happening at sort of the lightning speed that seems to happen for people on a full dose, or even on like 50 milligrams every 2 weeks. Again, my dose is 25 milligrams every 2 weeks. So yeah, it's happening at kind of a snail's pace, but that's okay. I don't mind that, and it's still definitely rewarding enough to be happy with this dose, although I definitely could see myself wanting to go to 50 milligrams or wanting to go to every 10-day injections instead of every 2 weeks, because I feel like that strikes a really nice balance in terms of hormones. It's not every single week, but it's, you're getting the next injection at the time where testosterone has pretty much left your body at higher than normal levels for female-bodied, female assigned at birth individuals, and there's definitely something to be said for that, because I've definitely noticed, even though I've only had 3 shots, that both times before the next shot, in the day or two before, I definitely had a little bit of a crash, and it was more noticeable because of how great I've been feeling. So that just made the lows kind of more low, and they just had a different quality to them. Like the mood swings, like, it seems like I could get into a space where I'm comparing myself to biological males in almost a more self-destructive way, which I've heard from a few trans guys, and I definitely want to try to avoid that, but undoubtedly there's a learning curve with this stuff, learning how to deal with that, and I'm really glad I'm still seeing a therapist, because I actually am hoping to talk to her about some of that stuff today. But yeah, I do want to talk to my endocrinologist when I see him in a couple months about possibly every 10-day injections, or going on a patch for the last few days, something like that, just like laying it out on the table and seeing if there's anything we can do to ameliorate, the mood swingy stuff that comes with injectable tea. Let's see what else. I made notes this time for my video, and it feels a lot more organized. I contacted Dr. Brownstein in San Francisco about top surgery, and he, after we emailed back and forth a few times, he ended up quoting me $5,500 for the double incision procedure, and then with like $2,000 additional fees on top of that, like anesthesiology and stuff like that. It's expensive, but I feel like he's the right guy for the job, the right person for the job. And also, I have a hunch I'll be in California on the West Coast soon, because I am waiting to hear back from graduate school. 3 of the places I applied out of 4 are in California. One is in San Francisco, the Graduate Theological Union, which I actually got an informal email notifying me of basically acceptance to that program, their master's program. And I also got accepted on Monday, the day of my last shot, to Claremont Graduate University, which, I was over the moon when I heard that. I got an email, and I'm admitted to the master's in Women's Studies and Religion, with a 30% fellowship covering tuition that's merit-based, because I didn't actually apply for financial aid. So I'm feeling really strongly like I might be in Claremont, which I know is pretty far from San Francisco, but it's at least closer than Vermont. And, I don't know. I feel like I'll definitely be willing to travel up there and find the time. And I'm just sort of waiting to see what actually gets set in stone in terms of where I'm going to live. The 2 places I haven't heard from are UC Santa Barbara, which is a very competitive joint MA-PhD program. It's just a big commitment for them to take on students that are inevitably going to go on to PhD, because it's a joint program, and so it's very competitive. Like, there's around 200 people max that apply, and they only have like 15 to 20 spots, and so I don't think I'll be accepted. But if I did, that would be amazing, because Santa Barbara is pretty much paradise, I've heard, and it's a great place to go to school. It's beautiful. So I'll wait on that. That'll hopefully be in the next few weeks, and then hopefully in the next 2 days I should hear from Harvard Divinity, which, I don't know, I'm thinking that even if I get accepted, I might turn down their offer, just because I'm feeling California is the right place for me right now, not just because of school, but because of queer community. And I'm not going to let like a name brand institution change that for me, acceptance to that place. So we'll see. It's really exciting, and I just feel like it's really helping move forward my transition, such as it is, and my path. And and the cool thing is that I pretty much told all my schools that I'm transgendered, and I don't think I mentioned it in the GTU application, but in my Claremont application, I definitely devoted a few paragraphs in my statement of purpose to being trans, and I mean, and it's not just because of a minority status thing. It's, for me, it has a lot to do with my area of study, and my interests, which revolve around the body and gender and sexuality and just constructions of those things, in particularly in the Christian tradition and in medieval Christianity, in, you know, and the philosophy of the body in Christian thought and practice, you know, and that touches upon a lot of topics like, you know, women's issues and women's religiosity, and also things like mysticism, you know, ecstasy, asceticism, you know, like the early Christian monastic movement, which, you know, there's a lot of men and men's bodies involved with that too. So it's kind of, I don't know, you know, it's really gender studies, not just women's studies. But yeah, I think that I kind of presented my trans experience as giving me an interesting perspective on all that stuff, just because it's made issues of the body so front and center for me. That, yeah, and seems like they liked it, Claremont liked it, so that's really cool. That's just after I wrote those statements, I had some reservations. I was like, you know, is this kind of TMI, or will they think that I'm trying to, like, pander to their, the whole, like, commitment to diversity and whatever that a lot of post-secondary institutions have, but it's really, you know, it really wasn't that, and I was hoping that they would be able to differentiate that, instead of hearing, like, oh, it's some little white person, you know, claiming that they're somehow a minority, which I definitely didn't feel like I was doing, but, yeah, I don't know. So, anyway, this video is getting long, so I'm gonna wrap it up, but it's been good to talk to you all, and I'll see you soon.